Hello, friends and colleagues. Welcome to Health Talks, your insight into public health-related topics. I'm your host, Thomas McMinn, and in this episode, I'm speaking with Dr. Angela Dunn about her new position as the State Epidemiologist. We're going to jump into it. For the few people that are listening to this that do not know who you are, please inform the people what you do for the department,
Sure.
How you got into what you do, just a little bit of backstory.
Sure. So I'm currently the State Epidemiologist for the Utah Department of Health. What that means is I lead disease control and prevention efforts for the state of Utah, basically. So I support our state and local epidemiologists in terms of identifying diseases, the priority of diseases to go after, investigating any disease outbreaks, and then identifying good control measures to make sure that people either get healthy or stay healthy. And part of my personal statement of going into medical school was I want to become a physician in order to go into public health and health policy. So I knew that this was my end goal upon entering medicine, that this is kind of how I wanted to use my medical experience, was to better a population's health rather than one-on-one patient care. And so from there, kind of finished medical school, did a residency in preventive medicine and public health, fellowship with the CDC, and through that fellowship, I was actually based here at the Utah Department of Health. So I got used to everybody here, got to know people, and luckily they wanted to keep me on. And so after that fellowship, was able to become the Deputy State Epi, and now transition to the actual State Epidemiologist. So it's great, yeah.
When did this new role actually go into effect?
Sure. At the beginning of January, so January 2nd, I think, was the official day. I had the fortunate luck to have Alan Nakashima as my supervisor as a CDC fellow, and then again as Deputy State Epidemiologist. She's our immediate past State Epidemiologist, and she is a great mentor, and for whatever reason thought that I would be a good successor to her, and so she's still around part-time though, so I was able to learn a lot from her and still use her expertise as needed.
I really like that, and I kind of want to veer off a little bit and talk about that.
Sure.
So mentorships,
Yeah.
kind of what does that mean to you, and what could you do you think, to kind of reciprocate that?
Yeah, absolutely. I mean, a physician in public health is definitely a rare course for people entering med school and then actually going through training. Most people say, why would you want to go into public health? You're not going to make any money. Most people see clinicians or physicians as doing that kind of one-on-one patient care, working in a hospital or a clinic, doing surgery. So wanting to do more population-based health is not the norm. And so finding Alan, who's also a physician at this point in my career, was just really fortunate, because she's already done this, and kind of, looking at someone who's doing what you want to do is so just instrumental in being able to kind of chart your own path. So it was great. And then I think, for me moving forward, I definitely influencing the next generation of physicians and trying to encourage clinicians to go into public health so we have that perspective continuing on in public health is really important. But also, working with our epidemiologists who have masters in public health and encouraging them to gain a variety of experiences, maybe not just stay in public health, but while you're young, try out a lot of different things. And if you want to come back to public health, it always helps to have that varied background. So definitely trying to carry the torch forward in terms of mentoring the next generation, whether it's physicians or other practitioners of public health.
Sure. So kind of walk me through your typical day then. Generally, what is your core goals and things that you need to make sure happen daily? Well,
what I love about public health is that it's totally chaotic, but generally between the hours of 8 and 5. So that's what's different than, for example, doing hospital medicine. But, in that chaos, in general, my goal is to provide the best subject matter expertise or consultancy to our epidemiologists. So we have epidemiologists who are all disease focused. So we've got, our zoonotic epi, who deals with diseases that transfer from human or animals to humans. We've got cardiovascular disease epidemiologists. But, my goal is kind of at the 50,000-foot view is to provide them the best advice, whether it is disease specific or population-based or epidemiology, the science of epidemiology. So making sure that they have the tools and the knowledge to do their job the best way they can. I also interact a fair bit with local physicians. So when they have questions for, diseases that they rarely see, for example, treating rabies, or, if somebody was exposed to rabies, what do you do giving prophylaxis? Those types of rare things that come up for our local clinicians, they can call up and get the proper advice too.
So a lot of people aren't going to take the general direction that you took.
True.
leading into this field, right?
True.
So what would your recommendations be for maybe the high school student or the college student that wants to get into at least the epidemiology profession? What recommendations would you have for them?
Yeah, so I definitely think field experience is key in terms of gaining that hands-on knowledge for epidemiology and public health. First starting probably in your undergrad degree, getting those basic skills. So taking your, statistics, your epidemiology, your health courses, so you have that background. But then doing some work experience before jumping into graduate school, because I think, especially your master's in public health, but other graduate studies are similar. It always helps to have some work experience so that you know what you want to get out of your graduate studies before you're kind of spending a bunch of money on graduate studies. I mean, we do that enough for undergrad, right? So really just volunteering at a local public health department or a local nonprofit that deals with health or health-related issues. Now more than ever, we're intersecting the social determinants of health with actual traditional health. So working at a homeless shelter, helping people get connected to substance abuse services, those sorts of experiences are really viable in public health as well. So kind of working in those industries would be helpful.
Tell me, what are some of the expectations with your new role? Also, does every state have a state epidemiologist? And does that entail a group or a team underneath you? Kind of walk me through some of that.
Sure. So every state does have a state epidemiologist. So I am basically the lead epidemiologist for disease control and prevention at the Department of Health, which has both the Bureau of Health Promotion, which is chronic disease, violence, and injury, and also the Bureau of Epidemiology, which is traditionally our communicable disease group. So I oversee all of those epidemiologists, but not from like a management perspective. So I'm not signing all their time cards, but more from a content expertise and like how they're doing their work and what they're producing and things like that. And then also working closely with our local health officers. So at our local health departments, they usually have a medical director and or a local health officer. And so coordinating with them in terms of what diseases are they seeing down on the ground at the local level and how can the state best support our local health departments in ensuring the health of their populations. In my new role, so as state epidemiologist, me in particular, what I will be focusing on are, of course, the big things that are going on in Utah right now. The epidemic is huge. So working across governmental organizations, but also multi-sector organizations to address this epidemic and providing that Department of Health perspective and resources to that issue. We're also working a lot with our youth suicides, so trying to figure out how best to address that. And then any outbreaks that come up. We've always got communicable disease outbreaks going on. Currently, we've got a huge hepatitis A outbreak. Sure. So providing that medical expertise in the outbreak response and ensuring that the interventions we're doing are actually decreasing our case count and controlling the outbreak. So those are the types of things we'll be doing moving forward.
What would be then the legacy if you had just like a 5-year window that you could capture something within this next 5 years doing? What would that be?
So I really think we need to break down silos in public health, and we have so many opportunities for collaboration, both internally within the Utah Department of Health, but externally across sectors as well. So that means, not seeing, for example, HPV as a vaccination issue, but it's also a cancer prevention issue. Looking, and that can work with our STD department, our immunizations department, and also our cancer control program. So really trying to break down those silos so that we can work more effectively, especially we're a state with limited resources, towards public health. And so really trying to engage people across domain expertise and then across sectors. So how does the Department of Health work with transportation to make sure we have walkable communities? And I think those types of relationships will help build lasting public health infrastructure and really kind of go to the longevity of improving health for Utahns.
All right, so something else that is brought to my attention just because of how much social media is impacting all jobs, all careers, all sectors, right? How do you feel that this whole online world, especially in the social media realm, is going to affect people coming into epidemiology or even current epidemiologists, the way that they need to gather information?
Sure. So I'll answer the second part first. I mean, social media is certainly affecting epidemiology and applied public health. For example, there's studies even out of the CDC, which is kind of our mothership, the Center for Disease Control and Prevention. They use Twitter feeds to identify outbreaks. People have used Google searches to know when a flu epidemic is going to get worse. We use Yelp reviews to understand when foodborne outbreaks happened. So that availability of timely data from social media is being used, not to its full capacity, but we're trying to figure out how to do it better. Obviously, epidemiologists are scientists, so they want to trust the data. So social media inherently enters this kind of, are people telling the truth element? But we kind of have to get over that, and we have to try to figure out how to best use it. So we're trying to harness social media data. I think it also provides us the great opportunity to get messages out very quickly and in a timely manner to large populations as social media becomes more and more ubiquitous. So in emergency situations, using social media to identify people who have been exposed to measles, for example, or to hepatitis A, as I had mentioned before, has been really useful to control outbreaks more quickly. And so in terms of young people wanting to enter the field of epidemiology, I think making sure that current public health is using social media to its capacity will only help young epidemiologists find it more interesting and more useful, so that the field of epidemiology and public health progresses with society is really important, so that we attract young people to the field.
Primarily with epidemiologists that work in the department, would you say it's heavier on the number side as far as the data and infrastructure there versus the traditional health?
No, that's a great question. A lot of it has to do with the Affordable Care Act, in that healthcare systems are now required to do more community-based interventions. So they're doing a lot of the things that public health traditionally did, right? So back in the day, I don't know how long ago that was, but it was probably less than 10 years. Public health was seen as that provider of services to people who couldn't otherwise get health care. So we would do a lot of prenatal care, STD treatment, tuberculosis we still do, but vaccinations, those sorts of things. But now we have most of the people we have in our state, especially the state, are insured, and so they're able to get those services through their primary care provider, and that's better. We want that because then they have this primary care medical home, and they can really get connected for a lot of health outcomes. So we in public health, don't really provide services that much. And so at the State Department, what we do more is kind of that data, so surveillance, so making sure that we have the correct and appropriate data to understand the disease burden across the state for whatever disease it is, and then also policy. So how do we use the data that we have to educate our legislators to make sound policy decisions? So we really have that kind of strategic vision, and our epidemiologists are heavy in that. So in terms of ensuring that we're getting timely, accurate data, and then translating that data to laypersons so that they can form policy that will then affect the health of all Utahns.
You're taking all this data, you're kind of conforming it into one specific package, if you will, and making sure that you get it out there so that then someone can write a policy or procedure to best address the current situation that's happening.
Okay. And then for our, and then we've got local community-based organizations that can take that data to identify what interventions they need for their specific populations. And our local health departments do the same. So it really is about informing stakeholders so that they can take action.
One big and final question, why public health?
I value public service. And so it's about kind of using what's been given to me in terms of education and ability to influence others for the betterment of society. And for me in particular, it's health and medicine. And so how do I use that to impact a population that might not otherwise have that voice for themselves and really address those health disparities and reach out to those populations? So that idea of public service is, for whatever reason, a core value that I hold, and this is the way I can use medicine to reach that. So the people that work at the Department of Health are awesome. I mean, everybody here loves their job, and they're really, really trying to do the best with the resources they have, and they're really passionate about whatever disease or project they're working on. So it's just so fun working with people who love to come to work every day, and we all have the same mission and value set, and that's just unique, I think, and I feel really fortunate to be here.
So I think to wrap it up, first and foremost, congratulations on the new position.
Thanks.
Dr. Angela Dunn, it's very nice interviewing you on this. Thank you so much.
Yeah, thanks. I
appreciate it.